Hi everyone, welcome to the class of Pediatrics, Kids Discovery. Myself Dr. Parv and we are discussing Pediatrics. Let's quickly start with the topic in the Pediatric Orthopedics and Rheumatology, and the name of the topic is Osteoid Osteoma. Now, Osteoid Osteoma is, as the name suggests, osteoma, and anything which is ending with the word oma is actually a benign disease. Okay, it's actually a benign disease. And osteoid is something is in सब हटा देना editors. So osteoid osteoma is tumor, and the name suggesting osteoid. So osteoid is some substance which is actually responsible for osteoblastic activity. Okay, for osteoblastic activity. So it's a benign osteoblastic bone tumor which is composed of a small central nidus surrounded by a reactive sclerosis. So in the center you will be having the osteoid material, and surrounding it there will be a reactive sclerosis which is going to be there. So what is sclerosis? Is actually fibrosis, nothing more. So it's a benign osteoblastic bone tumor which is composed of a small central nidus surrounded by a reactive sclerosis. Okay, now generally osteoid osteoma is seen in the young men. Okay, it is seen in the young men which are commonly second and third decade of life. Okay, and in these patients, like osteoid osteoma is something which is going to affect mostly your knee, like in the femur, like in the tibia. This is going to be there. So 80%, 90% it is the tumor of the diaphysis of the long bone. So osteoid. Okay, let me just tell you osteoid. Okay, where should I write? Here I'll write osteoid. So what is I and D? So DI is actually die means it is the second decade which is going to be there, and DI is also suggestive that we are having the involvement of diaphysis. So what is going to happen? What is the common symptom of it? So the DI means this has got diurnal variation also. There is a variation in the day and night. So you will be having a nocturnal pain. Okay, so what is going to happen? There is going to be a nocturnal pain. So the pain is going to be in the night time, which is actually seen to be relieved by aspirin and NSAIDs. Okay, so once the patient consumes the aspirin, the patient consumes NSAIDs, this pain goes away, but the patient will complain of a night time pain. Okay, diurnal variation, night time pain is going to be there. Okay, but clinical clues suggest that there is a back pain also, there's a neck pain also which is going to be happening. So I just teach students like this, that just like die you can have bi means B is going to be back pain. So back pain means the patient presents with back pain, patient's presents with scoliosis. Okay, scoliosis is going to be there, and yes, of course there can be referred pain, there can be non-radiating pain also, but referred pain is also something which is seen in the osteoid osteoma. Okay, referred pain is also seen. So what will you see in the radiological findings? And radiological findings have been asked in very high amount in the competitive exams during some past years. So please consider it to be a very, very important tumor. And one thing which you have to keep it in mind, I always say that there is a small radiolucent nidus with a sclerotic rim. Radiolucent bole to beech mein se, in the center it will be black color, and in the surroundings it's going to be what? It is going to be the white color which will be there. Okay, so X-ray is going to show you this. Can you see? This is the white color in the end, and this is the black color one inside, and there is a very hard and strong bone which is there surrounding it. Okay, so hard and sclerotic bone which is going to be there. But in order to see properly the nidus, CT scan is something which is done. Biopsy is rarely needed. Okay, biopsy is not needed, but if you perform biopsy, what you will see a lot of osteoid substance which is going to be there, a lot of osteoid substance which is going to be there, and which will be surrounded by a lot of fibers. Okay, there will be a lot of osteoid substance. Can you see this pink one color is the osteoid substance, and which is going to be surrounded by a lot of fibers. Okay, so there are lot of fibers, substances, lot of fibers, purple colored fibers are there. Okay, so lots of fibrovascular tissue is going to be there. Now, one of the differential diagnosis for osteoid osteoma is osteoblastoma. Now, osteoblastoma, please understand, the osteoblastoma is a tumor which is, can you see L and A are coming together in osteoblastoma? What does this mean? L means it is less responsive and A means it is less responsive to aspirin. Okay, so osteoblastoma is less responsive to aspirin. L for one more thing, L for it is a larger tumor. Okay, L for it is a larger tumor, larger as in more than 2 centimeter. Of course, less responsive to aspirin or less responsive to NSAIDs. Now, osteoid osteoma is a good one. Okay, is a good one. So osteoid osteoma is a good one. Okay, good one means it is responsive to NSAIDs, is responsive to aspirin also. And please remember that it is minimally invasive. It's not too much invasive, it's minimally invasive. So we do percutaneous radiofrequency ablation. Okay, we do percutaneous radiofrequency ablation in this, and in order to do surgery we do the excision of the nidus. If pain is unresponsive or NSAIDs are intolerable, then we do the surgical excision also, excision of the nidus. Okay, so this is all about the osteoid osteoma. Just remember that surgery is done only if the pain is unresponsive. Okay, unresponsive to the NSAIDs. Okay, so this is just a cute little small topic, osteoid osteoma. I have dealt with all the important points I have tried to bring in for you. So thank you so much for watching, and God bless you.